Hi, fellow future RNs. So, katatapos lang ng November 2023 PNLE. And I want to congratulate the future RNs no, in advance. Congratulations. I know na you did your best para masagutan no, lahat ng questions sa PNLE. And all you have to do now is, rest, sit back, and, pray and wait for your license. Sigurado magpapasko kayo ng may lisensya. So anyway, speaking of PNLE, marami akong nakitang video sa TikTok and information sa newsfeed as well na sinasabing may lumabas daw na questions about traction. Okay, so syempre ang ante nyo, dali-dali nag-review at nag-refresh about traction. Kaya isa-share ko siya sa inyo today. Okay, ang traction is isa sa mga interventions no, na binibigay natin kapag ang ating patient is may fracture. No? So, kasama niya dyan yung reduction, fixation, and also yung sa cast, yung casting. Okay, so ano nga ba yung traction? Traction is the exertion of a pulling force applied in two directions to reduce and immobilize the fracture. It provides proper bone alignment and reduces muscle spasms. Okay, so ito yung mga example ng traction. Okay, these are general interventions no, kapag ang patient nyo is may traction. Okay, first is maintain proper body alignment. Second, ensure that the weights hang freely and do not touch the floor. Kasi kailangan niya yung weight. Walang silbi yung weight mo kung nakalapag yan sa floor. So, kailangan nakahang siya freely. Do not remove or lift the weights without the doctor's prescription. Yung kung gaano kabigat, yung bigat yan, in-order din yan ng doctor. Okay, tapos kung i-rest or kung continuous lang na naka-attach yung weight doon sa ating patient. Ensure that the pulleys are not obstructed and that ropes in the pulleys move freely. Place knots in the ropes to prevent slipping and check the ropes for fraying. Siyempre baka mamaya sira na yung rope mo, bigla na lang mapatid o maputol. Okay, so ang traction natin, merong mga types, no? So, first is your skeletal traction. Okay, skeletal traction is applied mechanically to the bone with pins, wires, or tongs. So, from the name itself, so, hayaan mong tulungan ka ng pangalan. No? Sa pangalan pa lang, meron ka ng idea. So, kapag skeletal, nandun siya sa skeleton, sa bone. So, gumagamit siya ng pins and wires or tongs. Yung typical na weight for skeletal traction is 25 to 40 pounds or 11 to 18 kilograms. Special considerations kapag merong skeletal traction ng ating patient. So, you monitor the color, motion, and sensation of the affected extremity. You monitor the insertion sites for redness, swelling, drainage, or increased pain. Baka mamaya nag-i-infect na yung site. And provide insertion care site as prescribed. Kasi yung pins doon, yung sa nakalabas, nililinis kasi yun, depende din sa order ng doktor. So, ganito yung skeletal traction. Yan yung mga pins niya, di ba? So, yung dyan na part, syempre nililinis yan. Okay. Next type is your skin traction. So, skin naman is applied using elastic bandages or adhesive, foam boot, or sling. Kapag may skin traction ng ating patient, be cautious to avoid excessive pressure on the skin that could result in a pressure injury or skin breakdown. Or baka mamaya kapag masyadong tight, no, yung bandage mo magkaroon ng compartment syndrome or any complications doon sa patient. Wrapping too tight could also increase the risk of compartment syndrome. Okay, yung ating skin traction, meron pa siyang several classifications, so iba-ibang klase ng skin traction. So first, meron tayong tinatawag na cervical skin traction from the name itself, cervical. So ito ay ginagamit to relieve muscle spasms and compression in the upper extremities and neck. Kaya siya cervical skin traction. So ganito yung kanyang itsura. Ang cervical skin traction uses a head halter and chin pad to attach the traction. See? Yan ang kanyang chin pad at yung kanyang head halter. Okay, important considerations, use powder to protect the ears from friction rub. Position the client with the head of the bed elevated 30 to 40 degrees and attach the weights to a pulley system over the head of the bed. Okay, next we have box skin traction. Ang box naman is used to alleviate muscle spasms and immobilize a lower limb. Sa lower limb naman siya. So this is done by maintaining a straight pull on the limb with the use of weights. So sa box traction, ang ginagamit is gumagamit ng boot appliance. Gumagamit ng boot, so nilalagay siya. So ito yung boot. So the weights are attached to a pulley. Allow the weights to hang freely over the edge of the bed. So ito dapat nakahang freely, hindi nasa floor. Okay. Important considerations, not more than 8 to 10 pounds or 3.5 to 4.5 kilogram of weight should be applied as prescribed. Hindi dapat daw lalagpas ng 4.5 kilograms. And elevate the foot of the bed to provide the traction. Kasi nga, hindi dapat nakahang freely siya. Okay? Next is yung ating pelvic skin traction. Ito naman ay ginagamit to relieve the low back, hip, or leg pain, or to reduce muscle spasm. Important considerations: apply the traction belt snugly over the pelvis and iliac crest and attached to the weights. Use measures as prescribed to prevent the client from slipping down in the bed. The last one is yung Russell skin traction. Ang Russell skin naman is a form of traction na ginagamit to align a fractured femur. So, kung mapapansin mo, para siyang yung ating back skin traction. Ang kaibahan dito kasi, si Russell skin, yung meron siyang sling na ginagamit. Ito yung sling niya. So, babalikan natin si box. Boot lang siya, no? Tapos meron na siyang weight. Si Russell skin, meron siyang sling just below the knee, and pulling forces are exerted upwards and longitudinally by means of pulleys and weights. Next type naman of traction is balanced suspension traction. Ang balanced suspension traction naman is used with skin or skeletal traction. It is used to approximate fractures of the femur, tibia, or fibula. Balanced suspension traction is produced by a counterforce other than the client. Okay. Important nursing considerations: you have to position the client in a low Fowler's position on either the side of the back. You maintain a 20-degree angle from the thigh to the bed. You protect the skin from breakdown, provide pin care of pins if pins are used with skeletal traction. Kasi pwede siyang skin, pwedeng skeletal traction. Clean the pin sites with sterile normal saline and hydrogen peroxide or povidone iodine as prescribed or as per agency policy. Okay, ganito itsura ng balance suspension traction. Ito usually yung gumagamit ng yung mga Balkan frame na nakita natin. So yan yung ating balance suspension traction. Okay, so traction, you have skeletal traction, you have skin traction, and balance suspension traction. Kapag skeletal, meron siyang pins sa loob meron siyang pins na naka-attach doon sa ating bones. Kapag skin, sa skin lang siya. Kapag balance suspension naman, pwede siyang skin or skeletal traction. Basta gumagamit siya ng counterforce other than the patient. So, that's it for traction. Quick review lang. Sana may natutunan tayong lahat. And, magdasal tayong lumabas to sa 2024 kapag tayo na mag-board exam para makasagot tayo. Yun lang. Bye!